Hey guys, I'm going to show you how to tape a thumb to secure for a sporting event or after an injury. I've got Reese here with me. We've just taped his wrist, and that will be in one of our other videos. Often we'll use both of these in one tape job, but for him today, now we're going to show you how to just do the thumb. So the first thing is, as per all taping, is get the joint in the position that you want it. So I'll ask the guys to say, pretend you're holding a footy or pretend you're holding a cup. And so the joint's in a nice relaxed position so that when you tape it, they feel that they can use it. Often if they hold their hand in this position through here and then you tape it, then they're not going to be able to use it through here. So he's got his anchor taping on already because we've done his wrist. So if it hadn't been done, you'd put an anchor on, and then I'm going to come over and lay the tape on. Really importantly, when you come around this part of the joint, you don't come through too close to the webbing. And you'll notice I've just laid that tape on. I haven't pulled the tape on at all. And then I'll often wrap around the wrist. It'll give it a nice secure feeling. And then I'll start from the other end, and as per normal with all the taping, I haven't crossed straight over the same layer of tape. I've come over to about 1/3 or 2/3, and now again, I've followed the line of the tape rather than tried to pull it on. I'll generally do 4. Again, so little, I used to do 8s and come around all the way around and just wrap around the thumb again, and now I just do a 6 with each of them, and that should feel relatively secure. Now I'll leave it at that with this taping and we'll anchor it off, but what I'll do if they're running out onto the sporting field is I'll use some 2cm hand tearable, and we'll re-wrap over that, and that's just an over wrap which makes it makes it look really good, but it keeps it comfortable for the client as well, or the athlete when they're running on the field. And then at the end, of course, we anchor off tape, and Reese is ready to go, and he should feel that that's a nice secure joint, but he's still able to use it. And I think importantly, each person likes this differently, and if you're having it a bit, our forwards generally, in rugby at least, our forwards really like it to be secure and tight, and you can tighten them up as much as you want. But if you're someone who needs your hands a lot, say if you're a back or in rugby, or you're a netballer, then you're going to need a little bit more mobility, so you're going to need to be a little bit lighter. So just note that it does depend on the person as to how tight you're going to get that, and it is very individual. Okay, Blanch test, make sure he's getting blood supply into his thumb, which is a really important thing. Cool.